Hi viewers, I am Dr. Anitha, your fertility specialist. Today we will know about IUI and IVF differences. Most of the patients walking into infertility OPD, they will have this doubt of whether going for IUI or IVF. What is the difference between IUI and IVF? IUI is nothing but intrauterine insemination, where we do the egg development by just medications. Our aim is to develop only 1 or 2 oocytes, maximum 3 eggs only, not more than that. After that, there will be regular scans and we will give medications for these follicles to release the eggs. Around that time, we will take the husband's semen, process it, and this processed semen will be deposited directly into the uterus, so that there will be increased density of the sperms and increased number of the oocytes, and the distance between the sperm and the egg will be decreased, so that the any factors inhibiting the pregnancy like cervical factors or some other semen parameters or some abnormal secretions, these will be bypassed and they will go for successful pregnancy. The success rate with IUI is only maximum of 15%, that is 10 to 12% with a maximum of 15%. And people who can go for IUI is, there should be egg number, that is ovarian reserve should be normal. Tubes should be perfectly normal, there should not be any blockage, there should not be any adhesions inside. And semen parameters should be normal, at least more than 10 million count should be there, with motile count should be at least minimum of 5 millions. These couples can go for IUI with success rate of 15% maximum. Whereas in case of IVF, that is in vitro fertilization, here we give stimulation protocols, that is from 2nd or 3rd day of the cycle, the women will be given injections, hormonal injections, maximum of 10 to 12 days, and the follicles will be grown as many number as possible with regular ultrasound, and these will be, the growth will be monitored, and under anesthesia these follicles will be retrieved and oocytes will be examined under microscope, and each oocyte will be injected with a sperm, or IVF will be done depending upon the parameters. And these embryos will be grown in the lab for 3 to 5 days maximum, and then frozen or transferred depending upon the embryo quality as well as the endometrial parameters. So the success rate with the IVF is around 60 to 70% maximum. So because whatever happens in the tube will happen in the lab. So directly embryos will be deposited into the uterus. The implantation has to happen. That is why the success rate is also high, around 60 to 70%. So depending upon the technology involved also, IUI will be less economical, whereas IVF will be little more expensive due to the technology involved and the working hands involved. So if the tubes are blocked, who and all should go for IVF directly means prolonged married life with multiple failures with the OITA treatment or the multiple failures with the IUI. Prior they had some 3 to 4 IUI failures, prolonged married life, or a woman having grade 3 or grade 4 endometriosis, severe tubal pathology, bilateral tubal block, or severe semen parameter abnormality, that is either nil sperms or very less sperms, that is severe oligoasthenoteratozoospermia. These couples should directly go for IVF instead of wasting time in other modes of treatment. Thank you.